Good evening, everybody. My name is Dr. Kevin Smith, and I'd like to thank you very much for joining me on this webinar for the 3 easy steps to optimizing thyroid function so you can lose weight, get more energy, and lift your brain fog. So before we get started on the webinar, I have a couple of quick housekeeping rules. First of all, I'd like you to basically turn off all of your distractions. Please turn off your Facebook, turn off your TikTok, turn off the news, turn off all the games, and just kind of focus on this content because I need you to pay attention because we're going to be presenting a lot of really interesting stuff and I wouldn't want you to miss anything. So please turn that off. Also, please silence your ringtone on your cell phone so that it's not ringing and can cause a distraction for anybody. So the second thing is I would like you to interact with me. It's a lot more fun if we both play with each other. So I don't want to just be a talking head up here tonight. So I want us to have a little bit of interchange and go a little bit back and forth and have some fun. So I want you to interact with me. I'm going to ask you some questions and then you can go ahead and put your response in the chat section of this webinar. And the third thing that I'd like you to do is very important is that I want you to learn a lot and have some fun. Okay, so away we go. So first of all, I would like to congratulate you on taking the time to join me on this webinar. I know that you have a lot of things in your life. I know that you have your kids, your family, you've got your job, you've got all kinds of important things going on, and that you're taking a little bit of time out of your life to spend with me is very, very important. And I honor that. I'm going to try to hope that I meet your expectations for that. So congratulations on joining me, and I hope that we're able to learn a lot tonight. So the fact that you're here tonight tells me a couple of things. First of all, it tells me that you want to have normal thyroid function, and it tells me that the drugs that you're taking failed to produce the results that you want. Your doctor can't figure out what's wrong with you, and you know that something isn't quite right, and you want to get some answers. So, who this is not for. This is not for anybody if you're not really serious about taking responsibility for your health, if you're not interested in getting better, if you're not interested in improving your situation, if you're only interested in a quick fix and not a permanent correction, or just doing whatever the little bit that the insurance just is going to cover, this is probably not for you. And if you're only going to listen to the same doctors over and over again that have already failed you, this is probably not for you. So this is my big promise tonight. Today, I'm going to reveal what's possible if you are able to remove the blinders and eliminate the blind spots that are preventing you from, number one, losing that stubborn weight, number two, having lots of energy, number three, getting rid of the brain fog, and number four, eliminating the imbalances that are ultimately interfering with your life. So if you stay until the end of the webinar, a couple of things. Number one, I'm going to give you a free bonus gift. And number two, I'm going to give you a possibility of a customized solution for you to have sustainable effects so you don't become another statistic tonight. So let me introduce myself. My name is Dr. Smith. I am a board certified doctor of chiropractic. I'm board certified in integrative medicine, functional medicine, and clinical nutrition. I'm in my 21st year of practice. I'm a published author, a public speaker, and I'm a consultant to hundreds of doctors throughout the country on thyroid disorders and functional medicine. And my mission is to transform the lives of people suffering with low thyroid issues using a combination of lab testing and science-based nutrition. So Doug from Monroeville wrote that I now feel normal again. My energy is up. I get a full night's sleep. The brain fog is completely gone. And for the first time, I'm actually starting to lose weight. I feel like a completely different person. If you have thyroid problems, you need to try Dr. Smith. Kathy from Pittsburgh wrote that once I consulted with Dr. Smith, he put me back on a drug-free, natural approach to bring my body back to a neutral state. I'm finally back to my old, healthy, feeling great self, and I couldn't be happier. Thank you, Dr. Smith. And Mark from Pittsburgh wrote that because his approach to hypothyroid problems is different, I feel better than I have in 20 years. I've lost weight, my energy's back, and I can think clearly. If you have a thyroid issue, you must try Dr. Smith. He is an amazing doctor. So before we begin our journey together, I'm going to share with you a personal problem that I experienced about 2 decades ago. Earlier in my career, I had no idea how to help people with chronic thyroid problems. I was originally trained as a chiropractor, and as you can imagine, a chiropractor learns all there is to know about musculoskeletal problems like back pain and neck pain and knee pain and stuff like that, musculoskeletal stuff. But we're given very little training on how to actually diagnose and treat thyroid disorders and other complicated medical problems like that. So here are some of the symptoms of hypothyroidism just to get us started. So people that have hypothyroidism often are suffering with brain fog. They have stubborn weight gain, even problems losing the weight, even with diet and exercise. They have no energy or they feel fatigued all the time. They have some gastrointestinal problems such as alternating constipation or diarrhea or both, dry, brittle hair or hairs falling out in clumps in the sink when they wash their hair, or they have the loss of the outer 1/3 of the eyebrow, or they have cracked, brittle nail beds. They have aches and pains, nervousness, irritability, anxiety, depression, poor libido, sleep problems, and heart palpitations. So what I want to know, I want you to open up the chat and I want to know, number one, what symptoms have you been suffering with and that you want to get rid of? So go ahead and type that in the chat section of the webinar. And number two, what is the most frustrating aspect about having these problems? How has it been interfering with your life? I'd like to know about that. And number three, how do these issues, how are they going to affect your mood or your self-esteem or your self-image? Go ahead and type that stuff in the chat so we can have a little bit of dialogue, okay? So let's get back to our presentation here. So people were coming to me with the hope that I could fix their problems, and while searching for a completely different therapeutic approach, I actually stumbled upon something. And it was a discovery that ultimately changed my professional and personal life. In 2003, I learned about combining laboratory testing with clinical nutrition. And so I was finally able to figure out the root cause of complicated medical problems and then solve them. All right, so we have some responses here. So Marianne wrote completely loss of eyebrows and weight gain, and Barbara wrote weight gain and it's difficult to lose weight for her. Okay, so we're going to talk about exactly how to do that. Kathy wrote all of the above. Each is very frustrating in its own way as much as the others. And Lisa wrote extreme fatigue and hair loss. Okay, so we're going to make sure that we cover all that stuff during their webinar so we can help you to overcome those problems. Okay, so my journey to becoming what I call a medical detective involved, first I learned everything that I could about laboratory testing. And second, I learned everything that I could about clinical nutrition. So this journey, it took me about 21 years of going to seminars, reading books, taking courses in colleges and universities and everything so that I could try to figure out what could be causing all these problems with people. And we just got a response. Linda wrote brain fog, brittle hair, weight gain, and sleep problems. And Diane said, you had everything that the problems that you suggested, and you had a problem. You had your thyroid removed, and you need to know how to handle it. So we're going to cover that tonight during this webinar. So here's the result of combining the laboratory testing and the clinical nutrition approach. We were able to help people to lose the weight and keep it off. We were able to help them to lift the brain fog so they could think clearly. The people were coming to me and they're saying that I walk into a room and then I can't remember why I walked in that room. Has that ever happened to you? Yeah. Eliminating gastrointestinal problems or eliminating the need for having constipation and diarrhea, having tons of energy, going from completely, I don't have energy to do anything to being able to feel like they were a teenager again. Stabilizing their blood sugars, people that had insulin resistance or borderline diabetes, stopping their hair from falling out in clumps, healing their nail bed so their nails weren't cracked and brittle anymore, getting a good night's sleep, and ending the nervousness and irritability that's associated often with hypothyroidism. So the bottom line is that you're going to feel normal again once we actually figure out what's wrong, and then we can put an end to it once and for all. So how would this benefit you? How this is going to benefit you is that you'll have less reliance on medications. Boy, wouldn't that be great to have to take less medications all the time? Have better self-image and better self-esteem, more confidence, be more productive, have better peace of mind, improved relationships, and a brighter future. So let me ask you this question in the chat. Go ahead and type this in the chat. What would you be able to do if you no longer had any of your thyroid symptoms? Would you be able to get a better night's sleep? Would you be able to enjoy your family or be less moody and irritable? Would you be able to lose weight? And how would that affect your self-image and your self-worth? Being able to fit in your clothes again, or not having to avoid mirrors, or not being shy in front of the camera all the time. All this stuff is very, very possible for you. So you may be thinking that it may work on some people, but not on me, or my issues are too severe, or I'm stuck on all these medications that my doctors had put me on. My problems have been going on for far too long, or these problems are just a part of aging, or maybe I have bad genetics, or I don't know where to start. Okay, so Kathy wants to get a good night's sleep and to lose weight. It would be awesome. So Kathy, we're gonna show you exactly how to do that. Going for walks again and attending social events will definitely help you how to do that too. Okay, so there's 3 keys to success with this program. Number 1, you must be coachable and willing to take some action. If you don't take any action, you're not going to get anywhere. So you got to step up to the plate and take a swing and try. Number 1, you must focus on progress. You don't have to be perfect. In fact, I'm not perfect. None of us are perfect, but I want you to take imperfect action. As long as you're moving towards a goal, that's all that's necessary for you to get better. And you must commit to never letting self-doubt getting in the way of getting you the things that you want, need, and deserve. So you can do this. The past does not equal the future. So I don't care if you've had thyroid problems for 20 years or for 10 years or 5 years or a year or 6 months or 3 months. It doesn't matter how long you've been suffering with thyroid problems. It doesn't matter if you've had your thyroid removed surgically, or if you're taking a whole lot of Synthroid or levothyroxine or Cytomel, or your doctor said that there's nothing that we can do about this. There's nothing that they can do about it, but that doesn't necessarily mean that there's nothing that can be done. So as long as you're willing to take some action, you can get some help. So imagine life without limits. It's a lot closer than you realize, but you've got to take some action. You have to move towards your goals, okay? So again, let's define the problem. The problem with hypothyroidism is that it can cause weight gain, or the inability to lose weight even with diet and exercise. It can cause people to feel nervous or be irritable, have sleep disturbances, problems falling asleep, or problems staying asleep, gastrointestinal problems, low energy, fertility issues, or an abnormal menses, or you just feel crabby and miserable, or hot flashes and stuff like that, brain fog, hair and nail problems, skin problems. People feel like their skin is too dry or too oily, or a combination. They have maybe some depression and anxiety and aches and pains. So, okay, so Donna said that you have less fatigue and no more brittle nails. And Diane said that you want to get it back and you want to work in a high capacity job, love your life, and your grandkids are important. And you can't seem to do anything because you have no energy. That's a problem. So we're going to talk to you about how to fix that problem tonight. So thyroid problems, they can be resolved, okay? If you use the right type of technologies and you look in the right places, it can be fixed and can be reversed. So here, I'm going to give you a couple of tips right now, right this second, that you can do to get better energy immediately, okay? Would that be nice? So there's 2 things. Number 1, I want you to increase your water intake. I want you to drink at least 64 ounces of water per day. And the water is going to help to flush out your system. It's going to help to get rid of toxins. It's going to help to clear your brain and give you more energy. We're mostly made out of water energy anyway, so you've got to make sure that you're well hydrated and you're drinking at least 64 ounces of water. How much is that? So do you know those bottles that you buy at Walmart, those little cases of water that people buy? Each of those bottles is about 16.9 ounces. So here's the deal. If you drink 4 of those per day, you got your 64 ounces in, okay? That's not really that hard to do. So drink 64 ounces of water. And the second thing is I want you to cut back on the amount of sugar that you're taking in your system, highly refined sugar. And I want you to replace it with healthy snacks or high protein snacks. If you can reduce the amount of sugar that you're eating, it's going to reduce the amount of chronic inflammation. And that plus drinking more water is definitely going to improve your energy immediately without having to take any drugs whatsoever. So, okay, Betsy wrote she has a high TSH of 19.0. Doctor put me on thyroid, Thyroid. There's no difference. Betsy, there's a reason that your TSH is not being affected by the medications. We're going to cover that, but I'll give you a sneak peek about that. There's only a 17% chance of all of your thyroid problems even being touched by any medications that you're taking. So if you're taking Armour or Synthroid or levothyroxine or Cytomel or tyrosine, it doesn't matter which drug that is. It's not going to be affected by these medications. And so today was a flare-up day. Okay. So again, just to make sure we're clear about this, just to get some better energy, drink some more water, and then cut back or eliminate any kind of external sugars or sugary drinks or things like that. Okay, so this is the 3-step process to recovery. Number one, you need to I'm going to need to review your medical history. I need to see exactly what's going on with your health, and I need to take a look at what you've already tried, your doctors that you've been to, or your medications that you've tried to take, things like that. So I have a clear understanding about what's going on with you. The second thing is that we're going to need to check for imbalances in your physiology via some lab testing. We're going to cover that more later. And number 3, we have to incorporate a corrective care plan so we can correct these problems. Number 1, so that they're going to get rid of your symptoms. And number 2, so we can get you healthy again, not just to chase down your symptoms with a chemical. So let's talk about thyroid hormone for a minute. There are 2 types of thyroid hormone. There's T3 and T4. T3 is named because it's got 3 iodine molecules attached to it. And T4 is named because it's got 4 iodine molecules attached to it. Okay, so the thyroid hormone is produced by your thyroid gland. Your thyroid gland is a small butterfly-shaped endocrine gland that sits right about here in your neck, the base of the neck in the front, and it's about 2 inches long. And the thyroid gland controls many functions in addition to making thyroid hormone. For example, the thyroid gland is going to ultimately control your temperature. It's going to control how much energy that your body is using while at rest. It's going to control your menstrual cycles. It's going to influence a lot of other issues inside your body. Every single cell in your body is going to have a receptor set for thyroid hormone, so it's important that it's done regularly. So if you have too little thyroid hormone getting to your cells, that's called hypothyroidism. Hypo meaning low. So hypothyroidism actually represents about 97% of everybody that has a thyroid disorder. The other 3% is hyperthyroidism, or too much thyroid hormone being produced. But hypothyroidism is it's suppressed. And that's because of either insufficient amount of thyroid hormone being produced in your thyroid gland, or number 2, you have a problem with the thyroid hormone circulating around your body and reaching your cells, or number 3, there could be a problem where the thyroid hormone gets to your cells, but it's not being attached to your cells because there's a problem with the thyroid receptor sites. So that could be caused from chronic inflammation. So thyroid hormone itself kind of acts like an accelerator pedal in a car. If you step on the gas in the car, what's going to happen? It's going to speed up, right? So if you take your foot off the gas, then what's going to happen? It's going to slow down or it's going to come to a stop. So the same thing happens with thyroid hormone. So the thyroid hormone acts as an accelerator pedal for all of your cells in your body. So every single cell in your body, every single one has a receptor site for thyroid hormone. So all of your blood cells, your white blood cells, your red blood cells, your platelets, the sex cells such as the sperm and the ovum, the muscle cells are called sarcomeres or striated muscle cells. The cells that line your gut, such as called enterocytes, the muscles that form the brain, the neurons, the muscles that form the bone or osteocytes, or the cells that make up your liver, or hepatocytes, or every single cell in the body, everyone without exception has a receptor site for thyroid hormone. So if you don't have enough thyroid hormone getting into that cell, it's not going to be able to do its job. I'll give you an example. Let's say, for example, that you had a problem with thyroid hormone getting to your gut cells or your enterocytes. What kind of problem do you think you'd have if it was slowing down that function because you took the foot off the pedal for that? You would have a slowdown of your digestion or constipation. What happens if the thyroid hormone was not getting into your brain or your neurons correctly? Maybe you could have brain fog, or you could have depression or anxiety or some other type of brain-based problem. If you had a problem with it reaching your reproductive cells, maybe it could cause infertility or the inability to get pregnant, or abnormal menses, or hot flashes, things like that. So without exception, every single cell in your body has a receptor site for thyroid hormone. In that respect, the thyroid gland is kind of like a master gland for the entire body, kind of regulates everything. So there's a test that most medical doctors do called a TSH. A TSH means thyroid stimulating hormone. And this is TSH, or thyroid stimulating hormone, is produced by the pituitary gland inside your brain. And what it does is it stimulates the thyroid gland to make T3 and T4. And so everything ultimately starts in the brain. So the brain secretes TSH, and the TSH acts upon the thyroid gland, and then the thyroid gland can make thyroid hormone, T3 and T4. This is a test that's done by most medical doctors, and it's a pretty common test. The normal level that the lab reports back, the normal level of TSH is 1.8 to 3.0. And so levels above 3.0 is hypothyroidism. I know that's kind of backwards. It's kind of counterintuitive, but when TSH is high, that means that your thyroid level is low. It kind of has an inverse relationship with each other. When TSH is low, that means you have hyperthyroidism, or too high. So when you have a TSH that's above 3.0, that's hypothyroidism. So we just had a participant tell me that her TSH was clocked in at 19.0. That's a very high TSH. That means that she's suffering with hypothyroidism. Yes, Lisa, that can cause low stomach acid. Absolutely. A problem called hyperchlorhydria. The lining of your stomach is definitely influenced by your thyroid gland. So the standard thyroid treatment is something that your medical doctor, whether it's your primary care doctor or it's an endocrinologist or whomever, it doesn't really matter. This is the standard of care when it comes to thyroid. They're going to order some lab tests, and they're going to basically do the same type of thyroid care that they've been doing since the 1960s. It's about a 50-some-year-old standard of care that involves radiation, medication, and surgery. And while the names of the medications and the procedures may have changed a little bit over time, the actual method of care has not changed at all. It's the same exact stuff that they've been doing all this time. So the standard tests that your medical doctors are going to order for you, if they suspect that you have a hypothyroidism, is they're going to order a TSH test, and then maybe they're going to order a free T3 test if you ask them nicely. Most of the time, it's mostly just a TSH test. Now, a full thyroid panel looks like this. You have a TSH, a free T3, a free T4, a total T3, a total T4, a T3 uptake test, reverse T3, TPO antibodies, antithyroid globulin antibodies, and if we suspect a Graves' disease, a TSI test. Now, why is it that the doctors don't order all these tests? And the reason is because the doctors are going to order just enough tests to arrive at a diagnosis in order to prescribe a drug. In other words, they're going to do what's the insurance companies dictate to them, and they're not going to do anything else. They're tired of fighting with the insurance companies, and that's what they're going to do. So my question to you is, how can you possibly get all of the clinical information answered if you're not ordering enough tests? You can't just order a very small amount of tests and extrapolate from there and assume that you understand the rest of the pathways. You have to actually do all the tests involved to actually see what's going on. So there are 6 patterns of hypothyroidism or low thyroid. Okay, so the first one is called primary hypothyroidism. That is when the thyroid gland is not making enough thyroid hormone. That's called primary hypothyroidism. The second pattern is called pituitary gland dysfunction. So if you go a little bit higher than the thyroid gland up to the brain, if the pituitary gland is not making enough TSH, that's going to cause your thyroid gland not to be able to make enough thyroid hormone. Number 3 is underconversion of T4 into T3. And number 4 is overconversion of T4 to T3. That takes place in the liver and it takes place in the gut, the conversion of T4 into T3. So if you have underconversion or overconversion, you're going to have hypothyroidism or low thyroid function. Number 5 is binding globulin dysfunction. Now, globulin basically means a protein. So binding globulin is a carrier protein that picks up the thyroid hormone and moves it all the way around your body. So if you're not making enough thyroid binding globulin, then you can be making enough thyroid hormone in the gland, but if it can't get anywhere, guess what? It can't get to your cells and you're going to suffer with low thyroid symptoms. And number 6 is thyroid hormone resistance at the cellular level. So in that particular instance, you're making enough thyroid hormone, you're making enough thyroid carrier proteins to carry it around your body, but it can't get to your cells and do their job. Now, here's the deal. Only one of these patterns is going to respond to medications, and that is primary hypothyroidism, the number one at the top of your screen. That means that the other 6 or the other 5 are not going to respond. So basically, the bottom line is you have a 17% chance of your thyroid medication helping you. You have an 83% chance of it not fixing your problem. And all of this stuff can be identified through proper blood tests. So somebody had shared with me that they're taking the thyroid medication. It's not been helping. This is the reason why, is because only one of the 6 patterns that are causing low thyroid symptoms are being affected by medications. And again, it doesn't matter what medication you take. It doesn't matter what dose you take. It's not going to be able to be effective if it's caused from pituitary gland issues or any of the other issues. Okay, so let's talk about the thyroid. Let's talk about hypothyroidism. So when you have hypothyroidism, that means that the TSH is increased. Remember we talked about that? So if the normal level is 1.8 to 3.0, if it's above 3.0, that's low thyroid function. So in 80 to 90% of all cases of hypothyroidism, it's due to a condition called Hashimoto's hypothyroidism. So Hashimoto's is an autoimmune disease, and what this is when the immune system, those are your white blood cells that are supposed to be protecting you against bacteria or viruses or a protozoa or a parasite. The immune system starts attacking and destroying your own body tissue. So in the case of Hashimoto's disease, it's attacking and destroying your thyroid gland. So the white blood cells of your immune system are actually attacking and destroying your thyroid gland and shriveling up to nothing. Now, there's a couple of interesting points I want to share with you about autoimmune disease. Autoimmune disease, there's about 100 different autoimmune diseases that medical doctors have written about. Every single one of them is based on what is being affected, which body part is being affected. So if it's affecting the thyroid gland, that's called Hashimoto's. If it's affecting your joints and your knuckles, that's called rheumatoid arthritis. If it's affecting your skin, it's getting scaly and blotchy and red, that's psoriatic arthritis. If it's affecting your lung fields, that's called sarcoidosis. If it's affecting your entire body, that's called lupus. And so with autoimmune disease, there's no curing it. Once you have it, you're going to have it for the rest of your life. You can't flip the switch off. But while you can't flip the switch off, you can dim it down like a dimmer switch for your chandelier in your living room. You can dim it down and put it completely into remission so it's no longer causing damage. And that's what we want to try to do for you. So again, 80 to 90% of everybody that has low thyroid disease has Hashimoto's. That's not everybody, but that's almost everybody. So one thing that I want you to understand about this is that it's ultimately not a thyroid problem. It's an immune system disorder. So let me ask you a question. Who is managing your immune system? Okay, so if you're saying it's your endocrinologist, that's the wrong doctor for you, because the endocrinologists don't fix immune system issues. They fix hormone problems. So Hashimoto's can easily be diagnosed through some simple blood tests. Most medical doctors don't even test for it. And even if they did, it's not going to change the treatment plan at all. And again, autoimmune disease is incurable, but it can be put into remission. And that's what you want to hope for. If you can put things into remission, it's no longer causing damage. It's no longer causing symptoms. It's no longer interfering with your life. So getting back to this chart here, we're going to do some testing to see if you have hypothyroidism. So we're going to do a thyroid antibody test that comes in the form of doing a TPO test, thyroid peroxidase enzymes, and checking for antithyroid globulin enzymes too. And so it's either going to be positive or it's going to be negative. There's no in between. It's kind of like being a little bit pregnant. You either are or you're not, right? So if you are positive, if you've got Hashimoto's, then we have to do certain things. And then if you're negative, then we have to do some other things. So let's take a look at this. So if you have Hashimoto's disease, if you test positive for this, then we have to, number one, we have to identify the immune system imbalances that are going on in your body. So there's two broad divisions of the immune system. There's the Th1 side, and then there's the Th2 side. The Th1 side is kind of like the Marine Corps. They go in there and they kill everything. And then the Th2 division of the immune system is like that's the memory cells. So the Th2 cells remember every germ and every bug you've ever been involved in your entire life, and they give you lifetime protection. So if you have an autoimmune disease, what happens here is that one of those two divisions is too dominant and the other one's too recessive. In my cartoon on your screen, the Th1 is the recessive and the Th2 is the dominant side. It could go the other way though too. So the only way that we can identify which one is being affected is to do a 6-day immune system quiz. And then the next part is to rebalance your immune system. So it kind of looks like that. The Th1 and the Th2 are back in balance, in harmony, and your problem is put into remission. And then the next thing that we have to do to fix your thyroid problems is to identify the triggers. So what's a trigger? A trigger is a problem that is anything that can cause a disruption of your thyroid physiology that's not related to autoimmune disease. And so we've identified about 9 of these. Number one is anemias. Anemia is a problem where you're having problems transporting oxygen throughout your bloodstream. So it could be caused from a lot of different issues, but we have to identify that because that can cause a lot of issues. The second one is unstable blood sugar. So that's the number one cause of dysfunction in the body. Number one stressor in the body is abnormal blood sugar, such as insulin resistance or type 2 diabetes or things like that. Number 3 is adrenal gland dysfunction. And when you have that problem, you're having a problem producing too much or too little cortisol. That's a stress hormone that affects your brain. And when that's happening, it's going to cause 2 things. It's going to cause belly fat production, and it's going to cause brain fog. And we talked about that dreaded brain fog before. The next one is chronic inflammation. Chronic inflammation is not the same as acute inflammation. Acute inflammation is actually very helpful. So if you fall off your bike and you hurt your knee, it's going to swell, it's going to get red, it's going to get swollen, and it's going to hurt and generate some heat. That's normal. That sets the stage for healing and repair. But if something goes in there and they disengage the shutoff button, and that happens throughout your body, that is going to cause pathology. It's going to cause a breakdown of your cells. It's like putting a blowtorch in your cells, and it'll absolutely affect your thyroid function. It's being affected by hormone imbalances. And by that, I mean like the sex hormones, estrogen, progesterone, testosterone. Remember, boys and girls make both. And so you got to make sure that they're in the right quantities over the right time. Gastrointestinal dysfunctions. So what I mean by that is things like a problem with leaky gut syndrome, or a problem with abnormally high amounts of bad bacteria, or a yeast infection, or problems absorbing your food. Food sensitivities or food allergies, and that is something that we're going to want to do a test on to see how reactive that your body is to different food antigens. Stealth infections, or viral infections that have been never properly diagnosed and treated. And chemical sensitivities, problems where smells or certain chemicals cause irritation or headaches, or cause you to feel nausea. So how do we identify these triggers? It's a lot of stuff. We identify these triggers by doing some lab testing. And the lab testing comes in the form of blood, stool, saliva, and urine. And so what we do is we take samples and we send it, these things, and we send it to a laboratory, and they measure your levels of normalcy. And so if they detect that you have a problem on your labs, that could be an indication of an imbalance. And that is how you identify the immune system. And then the next step is to remove the triggers. So once you've resolved the immune system issues, and once you've removed the triggers that are ultimately driving your problems, guess what? Your thyroid problems are going to go away, and you're going to feel a hell of a lot better. So only proper testing and interpretation of those tests is ultimately going to uncover the triggers. So when we do these tests, thyroid dysfunction tests are ultimately a sign of metabolic dysfunction, and proper testing is critical for figuring this out. So first of all, we're going to want to check your blood and urine. We're going to run a full thyroid panel, which again is 9 different tests. We're going to do a comprehensive metabolic panel. We're going to check for blood sugar issues, anemia problems, a complete blood count, inflammation markers, vitamin D deficiencies, do some more hormone testing for checking for adrenal gland dysfunction or sex hormone problems or rhythmicity of that stuff, checking for food allergies, doing a blood spot test, checking for stool tests, checking for bacterial overgrowth or undergrowth, checking for a yeast infection or parasite infection, and autoimmune panels to see how your immune system is doing. So all these things are standard tests that we're going to want to check on you. And these are not things that your medical doctor is even going to be, he hasn't even heard of most of these things. So let's talk about a couple of cases here. So Sandy had come to me. She had been suffering for 15 years with weight gain, low energy, brain fog, and intolerance to exercises. So my treatment for helping Sandy was that I found and treated her for the following triggers. She had leaky gut syndrome. She had some food allergies, some adrenal dysfunctions, and some blood sugar problems. And so within 6 weeks, she was able to lose 20 pounds. I was able to get rid of her brain fog, and she was able to have better exercise and was better able to tolerate exercising again. So, okay, so Tracy had written, can we get access to these slides to review again? Yes, you can. I'll help you out with that. Okay. So Lynn had been suffering for 24 years with diarrhea, constipation, weight gain, and poor energy. I found and treated Lynn for the following triggers. She had Hashimoto's disease. She had leaky gut syndrome. She had food intolerances and chronic inflammation. And within 8 weeks, we were able to restore normal bowel movements. She was able to lose 25 pounds, and she had more energy than she's had in years. And Tracy had been suffering for 8 years with hair loss. Her hair was falling out in clumps. She had insomnia. She had problems falling asleep or staying asleep. She had brain fog, she had muscle pain and joint pain. She was just a mess. I found and treated her for blood sugar imbalances, some gut problems, and chronic inflammation. And within only 4 weeks, she was able to sleep throughout the night. The brain fog was completely gone, as was the chronic muscle and joint pain. So how would your life be different if you no longer have these problems? And what would you be able to do if you didn't have these problems anymore? Go ahead and type that in the chat. I'd like to hear what you have to say. So the question is, how would your life be different if you no longer had any of those problems, such as weight gain or energy problems or GI problems or insomnia, anything like that? And what would you be able to do if you didn't have those problems anymore? What would you be able to do better than you can right now if you didn't have those problems? So go ahead and write that in the chat section. Susan from Castle Shannon, Pennsylvania wrote that his methods of treating thyroid is different from physicians. Rather than taking more and more drugs, he found in certain foods that I was eating, which were the cause of my problems. His methods are different, they work, and I couldn't be more happy. I feel better every day thanks to Dr. Smith. This is truly life-changing care. So Kathy wrote that she'd wake up feeling great and ready to have a great day doing whatever you wanted to do. There you go. That's exactly what you want to do. You want to wake up ready to tackle the day and have as much energy as you need to for work and for play. So this is what I'm going to recommend you do. I'm going to recommend we do a strategy session together. A strategy session is when we do a questionnaire and then ultimately a deep dive into your problems. We'll do a detailed health history. I'll check your lifestyle and your nutrition and see how that's doing. So we can do ultimately a root cause analysis of your issues. I'll give you an action plan, things that you can do right away to help you, and give you some lab recommendations. So the strategy session, the normal investment is $197. Tonight, your cost for the strategy session is $97. So I'll take $100 off if you get going tonight. So the goals of the strategy session is, number one, I want to identify the root causes and barriers to your health. Number two, we need to create a personalized plan of action that will work for you. Number three, I want to help you to avoid the trap of chronic disease. Boy, wouldn't that be amazing if you had less reliance on medications? That would be number four. Offer a drug-free solution that worked. Number five, give you your life back. And number six, give you hope and clarity. So what's going to come next? The next is to make a decision to take some action and handle the investment and book your session. And the link to doing the strategy session is in the chat. So all you have to do is go into the chat of your screen, click on that link, and then book your strategy session with me, and we can get going with this. So when you book your strategy session, it will have something that kind of looks like this. It'll say book your $97 strategy session with Dr. Kevin Smith. And then all you have to do is select whether you want to do this by phone or by Zoom or internet chat. So this is my guarantee to you. I guarantee that I'll give you my undivided attention. And then I'm going to really listen to your problems and what's going on with you. And I'll give you my best. This is a combination of 20 years of my experience of education, experience, expertise, and knowledge, all that you're going to get. So what else can you get for $97? Well, you can get a dinner for out at a decent restaurant. You can get 2 tickets to a Major League Baseball game. You can get 2 fill-ups at the gas station, and that's pretty much 1 fill-up at this point. And you can get the opportunity to transform your health and your life with a strategy session. So as a gift, a bonus gift for registering for the strategy session, I'm going to give you a 5-day thyroid recovery weight loss plan ebook that's going to be emailed to you for free just by signing up for the session. So just something a little bit extra for you for taking care of that. So we can ultimately agree that, number one, you have a chronic thyroid issue, and it's not going to go away on its own. If it would have, if it was going to go away on its own, it would have by now. You want help, but you're not getting the help that you need from your doctors. And the third thing is you want to make a change, but you don't know where to start. The place to start is by doing a strategy session with me so I can see what's going on with you. We'll send you out some health questionnaires and understand on a deeper level exactly what's going on so we could identify the imbalances and order the appropriate lab testing to fix your problems. So it's time to change your life. This journey is going to require both of us to do our jobs. It's your job to reach out for help. And that begins with a strategy session. And it's my job to listen, to guide you, and to give you a plan of action that's going to change your goal. It's going to change your life. It's going to give you help you to achieve your goals. So if you're drowning and I'm throwing you a life preserver, you're going to want to reach out and grab it. Okay. So I thank you very much for listening to this presentation. I have some time for some question and answer. And so let's see here in this section, we have a question from Mary from Raleigh, North Carolina. And she says that my issues are weight gain, my hair is falling out, and I have no energy. What are your recommendations for me? So Mary, we need to explore your medical history so we can see if there's any clues as to what could be causing your symptoms. And so I recommend that you sign up for a strategy session tonight so that we can see what's causing your issues, and ultimately we can then have a chance of correcting them. Okay, Susan from Atlanta said that I have no energy. I've got multiple GI problems, insomnia, frequent aches and pains. And do you think it could be caused by my thyroid? And Susan, yes, absolutely. These are all symptoms that are associated with low thyroid issues. And the good news is that it can all be corrected. So we just need to know where to start looking. So the way that we can figure out what's wrong with you is by starting off by doing a strategy session. So I want you to go ahead and click on that link in your chat section, go ahead and sign up, and let's get going so we can get you a brighter future for tomorrow. Cheryl from Columbus wrote that, how do you determine if the issue is Hashimoto's or could it be something else? So Hashimoto's is ultimately determined by doing some lab tests. We check the TPO and antithyroid globulin enzymes. And like I said, it's either going to be positive or it's going to be negative. So if it's positive, there's some certain strategies that we're going to need to do to contain that. If it's not, then we're going to have to look somewhere else. But the way that you start to figure out exactly what's going on is to sign up for a strategy session so that we can figure out what's going on with you. Okay, so we have only time for a few more. Does anybody else have any questions for me tonight? Okay, I'll stick around a little bit longer if you do. So if you have any questions, please write it in the chat section. Okay. Okay, well, anyway, it doesn't look like we have any more questions. I thank you very much for attending this thyroid webinar tonight. Oh, actually, we do. Oh, yes. I can't wait to get started. I can't wait for you to get started too, Diane. So go ahead and click on that link and we'll get you going. Thank you very much for attending tonight's webinar. I thank you very much. And I hope that I can help as many people as possible. Go ahead and get signed up for the strategy session with me by clicking on that link and we'll get you going. Thank you very much for your time tonight. And I'll talk to you soon. Thank you. Have a great night.